If we want to start having an understanding of where psychology started playing a role in our understanding of health, we can start by looking at Charles Darwin. Of course, this guy, famous, going to Galapagos, coming up with the theory of natural selection. He's famous in biology, but this also transfers over to psychology. Darwin was interested in understanding this common ancestry between different kinds of animals, including humans. And he noticed that not only were biological similarities in existence, but also emotional. So he would see that humans who would experience emotions such as fear and excitement, well, animals would experience those same things. You would see dogs who would howl in fright. You would see chimpanzees who were smiling and acting joyful. And he figured out that if all of these animals are experiencing emotion, there must be a biological root to these psychological experiences. This was incredibly influential and eventually inspired a Russian scientist by the name of Pavlov to start looking at the relationship between environmental stimulation with learning and physiological responses. You might think of Pavlov most with his salivating dogs ring the bell and they start to associate. This was starting to see that there was a relationship between the outside world and physiological processes. Freud also ushered in a new way of thinking about how our brains worked, focusing primarily on unconscious thought. He's famous for psychoanalysis and understanding the subconscious, but that really applied to these physiological processes. He was looking at how the brain and unconscious thought could influence our health. Freud was originally studying women who were experiencing what was then called hysteria, which was an emotional response to unknown stimuli. And Freud determined this unknown effect was simply the unconscious mind having an effect on the physical body. Freud was the first one to study this connection of the mind in causing some kind of illness, and physicians who were interested in the mind-body connection gravitated towards his psychoanalytic concepts. This time period saw a rise in what was known as psychosomatic medicine, this idea that the psyche could produce different effects on the body. H. Flanders Dunbar observed that patients who were experiencing more stress and emotional strain were often the kind who became sick. Later, Shepard Ivory Franz also figured out a connection between the mind and body when he discovered that people would get better from illnesses when giving them simple sugar pills. This was the original placebo that was given. With this growth of psychosomatic medicine also saw the growth of biological psychiatry, the investigation of how physical processes were influenced by mental. So things like ulcers or asthma, which were previously thought to be completely psychosomatic, were later found to have biological causes. For instance, ulcers were caused by H. pylori. Asthma was associated with constrictions of bronchial tubes. However, rigorous research methods were able to identify that although there was a biological cause, the psychological experience would exacerbate this process, such as people who were experiencing more stress would in fact experience greater likelihood of ulcers or asthma attacks. Heart disease was also thought to be a very psychological problem associated with specifically type A behavior. Research later debunked this type A, type B personality idea, but it still pervades our cultural understanding today. But despite these advances in our understanding of how the mind affects the body, the 19th and 20th century understanding of medical science was very focused on the clinical side of things, trying to diagnose illness and fix injury with specific biological treatments. This was a period when we started to discover the importance of germs and using antibiotics such as penicillin and even washing our hands. Of course, these are things that we take for granted now, but this was not necessarily the way things were done. These ideas experienced a lot of resistance as they were discovered and attempted to put into use. For instance, the idea of hand washing is credited to Ignaz Semmelweis. He observed that there was a much higher rate of women dying following childbirth at one hospital versus at another. Through scientific observation, he came to the conclusion that the only real difference between these hospitals was that one of those hospitals was the location where all of the deceased women were going. That is, all of the dead bodies ended up in one place. The doctors would go straight from the autopsies to childbirth. Ignaz realized that the doctors might be carrying something from the previously deceased bodies And so at one institution, whatever was on those dead bodies was being transferred once again to these women. Through a series of experiments, he came to the conclusion that if doctors simply washed their hands with water and lye, that it would decrease this death rate. Unfortunately, when he came to the medical community with this, they did not look kindly upon his observations, thinking that it was crazy. They denounced him, said his ideas were unmedical, unfounded, and they pushed him out of the medical community. And this was not the first or the only time that the medical community was resistant to new ideas. In the mid-1800s, the American Medical Association was created in order to bring together physicians and communities to improve the nation's health. Their goal was to add quality and standardization to medical care. Efforts were made to integrate psychology into this training. However, the only real way psychology was incorporated was for understanding how to deal with communication and get patients to adhere to the directions they were given. However, psychologists did not give up. And with the growth of new technology, public health issues, and the rise of medical sociology, eventually health psychology became a thing.